Hello class, this is Oscar for HIM5340, and the topic of my presentation is social media in healthcare. Social medias are digital platforms that allow people to come together and form connections. Studying how social media impacts healthcare can help professionals navigate its benefits and concerns. So this presentation will explore the benefits and issues with social media. According to Nelson and Staggers, the benefits of social media are the content of social media sites, how social media is used, and the potential to use social media for research. On the other hand, the challenges of social media are maintaining privacy and confidentiality, the potential of engaging in inappropriate behaviors, security concerns, regulatory issues, and market pressure. Social media for educational purposes. A survey-based study of healthcare professionals gathered insights into how they use social media sites for educational purposes. The authors concluded that healthcare professionals under 40 years old strongly agreed that social media is effective for education. The authors found that social media sites Twitter and Pinterest had lower frequency users and at the same time were the most used for educational purposes. This information can be useful in creating educational content on social media platforms to target its users. And programs can be created that promote the educational aspects of social media to encourage healthcare professionals to engage on those platforms. Chronic disease management and social media. A study of video content had authors find ways to review the content of informative videos on YouTube. Using deep learning methods, authors found that videos with low medical information have more non-engagement, while videos with more medical information have less sustained attention. Authors point out that behaviors can be attributed by viewer interest and level of medical knowledge. Suggesting helpful videos can influence the patient's long-term interest in the subject and probably increase their engagement in their own care by watching videos that should interest them and that are at their level of medical knowledge. Maybe using such practices could be used to improve patient outcomes. Trust in social media in healthcare. In a study that seeks to solve the issue of malicious users by providing a detection scheme for attacks where users leave multiple reviews for one caregiver, the authors were able to detect when a user creates pseudonyms and leaves multiple reviews for the same provider. In this framework, the authors were able to recommend users to caregivers while guaranteeing the authenticity of ratings of recommended caregivers by detecting users that were leaving multiple reviews. As people seek caregivers online, it is important to have systems in place to protect the integrity of those seeking care. Having such systems can allow caregivers and patients to trust social media platforms. Adoption of social media and healthcare. In a survey-based study, authors looked at social media behaviors of small and medium-sized healthcare enterprises, and they found that perceived characteristics of social media and characteristics of adopters positively influence the adoption and use of social media. The authors attributed the influence of characteristics of social media to physicians' abilities to see the benefits and compatibility of social media to their work. Small and medium-sized enterprises can use this information to implement cultures at their companies that have attitudes towards social media that are positive. Fostering a positive view towards social media could be accomplished by showing caregivers how it can improve their work. These are my references, and this is the end of the presentation. Thank you for listening, and leave any comments in the forum.